Good morning, everyone. Thank you all so much for joining us today for this webinar on the impact of school closures on children with disabilities. My name is Shin. I am the founder and CEO of KACIE Strategies, and I am so glad to see so many of you who have taken the time today to attend this call. It's been a very tough year for many of us, and people have been impacted by this pandemic in so many different ways, including our children, and especially those with disabilities due to these prolonged school closures. And although, of course, depending on where you live or what school district your child is part of, there are some schools who have offered some type of in-person services. And now, of course, with the vaccinations being available for teachers and school staff, there's a lot of talk about schools reopening, at least with some sort of hybrid program. But the reality is that many of the schools have been closed for nearly a year, offering only virtual services. And I also am a parent of a child with a disability, and my children currently attend a school in Burbank that has only offered virtual learning the entire year, which has been extremely difficult because we're talking about not just classes, but therapies as well. So I am very familiar with some of the struggles that some of our parents have been experiencing. And as a parent, you try to do your best to make things work with the options that you're given. But when you have a child with special needs, you know that after a while, doing classes and therapies through the computer screen is just impossible most of the time. So today, we are going to be discussing some of these challenges that our children have been experiencing, whether or not they have been receiving adequate support and services, and when schools do reopen, how parents can ensure that their children receive the support to help them transition back and catch up with the lost learning experience throughout the year. We'll also talk about special education legal rights and what parents can do to ensure that they receive the needed support for their children to get back on track, as well as any compensatory services that they may be able to receive. We'll also talk about the health and safety concerns. There's so much information out there and constant updates about COVID-19, the vaccinations, and of course the school reopenings that's all related to this. So we'll address some of these safety concerns that parents may have for their children, or even therapists or service providers who may be considering returning to offering some type of in-person learning, whether it be classes or one-on-one therapies. And of course, we can't have a discussion on disability issues without talking about inclusion. There are many schools out there with amazing inclusion programs for children with disabilities, but I have been learning a lot that there are schools who have some sort of inclusion mainstreaming programs, but are not really equipped or prepared with the amount of training and education needed to actually make kids with special needs feel included. So we'll talk about these issues as well and provide information that can help parents navigate the special education system. So let me introduce you to our panelists who have joined us today for this discussion. First, we have Alexis Casillas. She is the legal director of the Learning Rights Law Center, which is a nonprofit organization in Los Angeles that currently provides free or low-cost legal representation, advice, advocacy, and even training to children and their families who have been denied equal access to a public education due to a disability or discrimination. We also have David German. He is an attorney and co-managing partner at Vanaman, which is a law firm that provides assistance to children with disabilities, as well as families with members who are disabled. And we also originally, as you probably saw in the flyer, we were supposed to have Dr. Alice Kuo, who is the chief of pediatrics at UCLA School of Medicine, as our panelist. Unfortunately, she did have an emergency that she had to attend to and will not be able to join. However, we have someone equally as knowledgeable and amazing with us. She is pediatrician and founder of Calabasas Pediatrics, and she's also one of the spokespersons for the American Academy of Pediatrics, Dr. Tanya Altmann. So before we start this discussion, just a couple of announcements for all of you who have attended this call. If you do have any questions, please go ahead and enter your question in the Q&A box that you see on your screen, and we'll try to address as many questions as possible, depending on the time, of course, at the end of the webinar. And I'd like to ask you to please put the name of the panelists that you're addressing your questions to, and try to make the questions as short and simple as possible, just to make it easier for us to navigate during the Q&A. Also, we do have some handouts that we want to share with you, although the webinar doesn't allow me to share documents directly to all of our participants. So what I'll do is I'll put everything in an email, and I'll send it all to everyone who has attended this call in a follow-up email later today. Okay, so there's a lot of talk in the news about the reopening of schools and vaccinations for teachers and school staff. And there are many parents demanding the reopening of schools. But on the other hand, there are also many who, of course, want their children to return to school, but may not yet feel comfortable sending their children physically back due to health and safety concerns. And especially for children with disabilities who may have underlying health issues, parents want to know if it's safe to send their children back to school when their schools reopen, or perhaps start some sort of in-person therapy services. So I do want to talk with Dr. Altmann first. I know that the American Academy of Pediatrics recently announced that it strongly encouraged schools to reopen. Can you talk about that recommendation, and why is it so important that children return to school, and how are these prolonged school closures affecting the mental and developmental health in children, particularly those with disabilities?
Definitely. So, it's been exactly 1 year since I was in the room with many of our local public and public school districts and private schools in Los Angeles area. And I live out in Los Virgenes Unified School District, so just outside of LA. But we were all together actually in the same room, because it was still allowed then, exactly a year ago, talking about, should we close schools? With what's going on, there was so much we didn't know about COVID-19. I don't even think it was called COVID-19 back then on that day that we were in the room. And, I went from the beginning of the week saying, no, there's not enough evidence yet to close schools. The kids need to be there. And then 4 to 5 days later saying, okay, now this virus is spreading. There's too many people getting sick. We don't know so much. We need to close schools now. And at that time, I said, closing schools is going to be the easy part of this. The hard part is going to be how and when to reopen schools. And immediately when we made that decision, I started working at that time, with the American Academy of Pediatrics and experts all across the country on reopening schools. And I actually published one of the first articles on that in CNN, which was last year, end of March, early April. And when I look back on that now, I'm thinking, like, that's exactly the same as what we're doing right now. Why did it take a whole year to get schools reopened? And I think, it's been much longer than any of us thought. And it's impacted our kids and families much more and much harder than any of us would have ever imagined. And, retrospectively, it's always easier to say, well, we could have done things differently. But, I do think this has gone on too long, and our kids are suffering. Many of them really need to be in school. For many kids, school is where they get that emotional support, the educational support. They get some of their health care, they get their meals, they get their therapies, especially if they have disabilities and special needs. And I can't believe it's gone on this long. And I understand some of the concerns, many of the teachers have concerns. But we know so much more about this virus now than we did a year ago. 6 months ago, we knew so much more about this virus. And we had very clear guidelines on how we could safely reopen school. And granted, those measures weren't necessarily feasible for every school, but there are so many ways that schools can get help. And I do think now's the time. Probably a few months ago was always the time. And, in California, January was a really hard time here, right? And I do think January, the schools should have been closed. Unfortunately, we can't make up for the fall, where I feel like we could have done things safely, and I wish we had. But now we really need to get back to that and, help all work together to open schools for our kids, because they need it. They have been suffering for a year now, and it's going to take a while to transition them back. It's not just going to happen, in one day.
And like I said, there are a lot of concerns, especially for parents who have children with disabilities. And although we hear, that COVID-19 doesn't affect younger children as much, it's also unpredictable who may end up getting severely ill and who may not. And we also hear about these new variants that are spreading, as well as the multi-inflammatory syndrome in children. Are any of these a concern that we should be thinking about?
It's definitely all concerning. I mean, this is a very weird and very scary and very dangerous virus. Now, that said, luckily, this virus has not been affecting our kids as much. And even my patients with special needs, with lung and cardiac issues who have had COVID-19 have luckily been fine. Now that said, there have been some kids that have ended up in the hospital, been seriously ill, and even passed away across the country. So this is nothing at all that we should make light of. But when you compare the younger kids to the teenagers and adults, we do feel that younger kids do fare better with the virus. Although they can still transmit it, they transmit it less often, is what the data shows. And especially with all of the mitigation strategies that schools have had in place, we really are not seeing much transmission in schools across the country. And I consult with schools all across the country. And I know sometimes with special needs kids, you can't necessarily put all of those layers in place, right? Because they may not be able to wear a mask. But if the teachers are masked with face shields and distance, and the surfaces are clean and the kids are spread out, and also if you're doing surveillance testing, which many of the schools I work with have implemented, all of these measures can all act as more layers to help keep these children safe. And so I do think it is possible. It's not easy, and it takes a lot of time and effort on the part of the teachers and the therapists and the parents and the school districts. But I do think it can be done. And especially now that we have most of our educators getting vaccinated, most of our therapists getting vaccinated, even parents as well, because parents of special needs kids in most cases are eligible for vaccines right now. That will also decrease the rates, because we do see that usually kids get it from adults, not from their peers.
And can you just clarify real quick about, children with underlying health issues? It doesn't mean that they're more likely to get the virus. It's just that if they do, they may end up getting severely ill. Is that correct? And as long as the safety measures are in place, it may be something okay to consider sending your children back to school, right?
Yes. So, I mean, in general, kids can contract COVID-19 just like adults can. They do seem to get it less often. Now, that said, if you have a child that likes to lick everything in sight, right, they might be a little bit more at risk than a child that's really immobile and isn't touching everything around them, or a child that can follow directions and stay distanced and sit in their seat. So it may be, child and family dependent, but I think most schools that are equipped for taking care of children with special needs, they also know how to help with those extra layers of safety strategies. So I know that, out in some of the districts that have been open for the special needs kids, they have been doing a really good job. And we really have seen very few cases, especially ones that we can track back to. Could they potentially have been contracted in school? And usually it's not in school, where we're seeing them in, outside activities, private therapy groups, in the home, brought into the home by a parent, caregiver, and outside of school environments is when we were seeing more cases of COVID-19 in the kids. I think the other thing important to know is about MIS-C. So what is it? It is a serious inflammatory disorder that appears to come weeks after catching COVID-19. And in many cases, we don't even know the kids have had COVID-19. They get a high fever for several days. They start acting really sick. They have rashes. They have other symptoms, and we get them into the hospital and hospitalize and treat them very quickly. And in Los Angeles, Children's Hospital Los Angeles has been one of the leaders in treating children with MIS-C, and their treatments have been very good. And so most kids have been doing fine. Parents often worry, is this something I'm going to miss? Your kids are going to be really, really sick. And again, you should always keep in touch with your pediatrician if your child is sick. But in most cases, this is not something that you're going to miss, because your child is going to be so sick that you are going to take them to be seen, and for help. Now, you've been hearing a lot in the media about increasing numbers of cases of MIS-C. But when we really look at the data and talk to experts, it's not that kids are more likely to get MIS-C now than they were 6 months ago. It's just that we have greater numbers of COVID-19, or at least we did last month. Right now, our numbers are dramatically lower, which is great. But in January, let's say, and early February, we had greater numbers amongst all age groups. So of course we saw greater numbers of kids, and therefore we saw greater numbers of this MIS-C. Now that everything is decreasing, which is very nice, we are seeing, decreasing numbers of all of these situations, in young children. And so now I think we are almost in the red tier, here in Los Angeles. And I think now is the time to start getting our kids back to school, because they really need it.
Right. And I think that you also touched upon this a little bit as well. But so now that the government has set aside enough vaccinations to vaccinate all teachers, although there are probably going to be some, folks who refuse to get it done because they're against vaccinations. But let's say if schools do reopen and let's say that most teachers and staff are vaccinated, you're saying that it's still possible for those who are vaccinated to catch the virus and transmit it to others, especially those who are not vaccinated, correct?
So if you have the vaccine, I mean, the vaccines are all very safe and very effective. So although there could still be a theoretical small risk of catching the virus and transmitting it, as more and more data comes out, we really learn that that is less and less likely of a scenario. And that's why even this week, the CDC has been putting out more guidelines for those that have been fully vaccinated. That said, in a school setting, just like I do in my office, I would still do everything right according to plan. We should all be masking, we should be distancing, we should be hand washing. I mean, you don't want to let up on any of those mitigation strategies, especially not yet. But as more and more people do get vaccinated, that is something that will help us get greater numbers of kids back to the classroom, back to being indoors as opposed to outdoors. So it is going to help.
I think that that's very important for those who are vaccinated to always keep that in mind, because I think that folks who are vaccinated, sometimes they feel a little bit more invulnerable and they'll go out, they'll of course continue or get back to their normal lives, which may expose them to the virus. And especially if you're dealing with, children on a daily basis who, are not vaccinated, I think it's always good for them to keep in mind that they always need to be cognizant and just be careful and continue with those safety measures.
Exactly. I do not behave any differently now than I did before my vaccine. In fact, I forget on a daily basis that I am vaccinated. My husband's not vaccinated. My kids aren't vaccinated. I mean, luckily, my office staff is, but there are still so many other people waiting in line for their vaccine. And we still need to do everything right and be careful to protect everybody else in society. And especially when you talk about our children and, the children that we're focused on with this call, those with special needs and disabilities, they may be even more vulnerable. So we still need to do everything in our power to help protect them.
And speaking of safety measures, these masks. So there are a lot of children, especially with disabilities, who are not able to wear a mask, like you briefly mentioned as well. And there are guidelines by the CDC as well as the California Department of Education that state that if children and people with certain disabilities are unable to wear a mask properly or cannot tolerate a mask, then they should not wear one. So if this is a scenario and that children are attending school, some kids are not in masks, but as long as the facilities are all equipped with all the safety measures and the teachers and staff are in their PPE, it still is safe. Is that correct?
So, first I want to say that most kids over age 2 can wear masks, even some with disabilities and certain, medical conditions. That said, there definitely are some that can't. But, I do have many parents that say, my son's not going to wear a mask. I can't get him to wear a mask. And if you start slowly, and slowly get them used to it in small increments, many of these kids will feel comfortable wearing a mask. It might take a few weeks and they actually will forget it's on their face. So again, if you have a child that has not been in school now for a year, you can go back and look at some of those instructions that we did, like putting it on their teddy bears, having you be a role model to slowly get them back to wearing it. But so there are fewer circumstances and conditions where kids absolutely can't wear masks. And so hopefully you don't have a whole entire classroom of those children, in just a few. But if the child is not wearing a mask, there probably should be even a little more distancing between them. I would want the therapists and teachers probably wearing 2 layers, so a mask and a face shield, which many teachers are wearing anyway. Outdoors would be safer than indoors, better ventilation. And then, yes, you still want to do everything else, the hand washing, the disinfecting, and all of that. And also, let's not forget testing, surveillance testing. We can do cheek swab, nose swab, saliva testing on kids. And even young kids with disabilities, although they don't love it, if they get used to it again, having them, gnaw on a little swab to get some of their saliva, is something that we can do. And, we can put them into the surveillance screening process, which can also help, identify anybody that has COVID-19 early and have them, isolate at home before they would be able to spread it to others.
And as of now, no children under the age of 16 are able to get the vaccine. Do you have an idea of when this vaccination will be available for younger children?
So right now, the Pfizer vaccine is approved for 16 and up. Moderna and J&J are 18 and up. And so there are also ongoing studies right now for kids 12 and up, and some have just started for 6 and up as well. How long will it take? You know, it's a really good question. I hope that this summer we have data on the 12 and older kids, and that, you know, in the fall we have some data on 6 and older. The studies are going to go faster in the younger kids than in the adults because they're mainly testing for safety, right? They don't necessarily have to do that phase 3 study because you're not going to vaccinate kids, send them out in the world, and then say, hey, who's getting, you know, COVID or not? It's really just, is this safe? Is this effective? You know, is the same dose? Do we need to go down on the dose? And so, but also we have the supply issue. And, you know, how do we actually get the vaccine to all of these children? So, you know, looking into my crystal ball, I think that there's a chance that high schoolers will be vaccinated by the fall. I don't anticipate younger kids will be able to, we will have the supply and capability to give to them till next winter. I hope I'm wrong. And maybe for those high risk kids and special needs kids, it will come sooner. But I think this is still a long process, and we still have a lot of adults that need to be vaccinated, you know, in our country first.
And lastly, so there are a lot of families who may not have the option right away to send their kids back to school, or may not want yet to have their kids go to school anyway. So possibly they may be planning some type of learning pod from home, or even starting up in-person therapy services. What types of safety measures would you recommend for these families, and possibly any advice that you'd like to provide?
So in general, school is actually safer than learning pods. And that's what we've seen over the last year as a pediatrician. You know, we see kids catch COVID in their learning pods, and often it's because things get a little more lax, right? You know, these kids, you think they're safe, their families are safe. You may not be following all the rules. They may take their masks off. They may be more indoors. So if you want to do it safely, you have to follow all the CDC and American Academy of Pediatrics guidelines for that, the same way you would if you were actually in a certified or licensed childcare facility or school. And that's really the only way to do it safely. So it's possible, and some people have been doing that, but I usually feel that the schools, because they are followed by public health departments, they are they are sorry, they have public health department comes in and looks at everything, you know, and certifies them and makes sure things aren't slipping through the cracks. And they're actually very good. I've been there when schools have been audited by public health, and it's like every little detail has to be right. If you don't have that sign on the right door that says wear a mask and wash your hands, like, you get points taken off. And so the learning pods don't always have somebody there, you know, going in, making sure every little thing is done right. So I do caution you, you know, when it comes to doing things privately on your own, that you really read and make sure that you follow the safety guidelines.
Okay, thank you for that. And also, real quick, someone, one of our attendees mentioned something about masks in the comments section. Just so you know, we'll be talking more in detail about the mask issue with our attorney later, David German. Okay, so Alexis, I'd like to talk with you. So there's so much going on in the news right now about school reopenings. There's a lot of back and forth between the teachers union and the LAUSD, and there's that $6.6 billion aid package signed by the governor to support the reopening of schools, and just a lot of talk about the vaccinations and other safety measures that are affecting the schools and the possibility of returning to in-person services. Now, can you give us just the most recent update and how this is all affecting the return of in-person services for our children?
Sure. So I was thinking about how to update what is so many moving parts and do so in a concise way. But going back to the writ that the Learning Rights and the Alliance for Children filed back in the fall, what we identified was that there were a certain set of barriers that were existing that had nothing to do with really what the laws authorized schools to do. And we came to the conclusion that there were really the need for 4 things to happen in order for schools to reopen and to do so safely. You needed to have lawmakers get together and put in place laws and mandates that establish what should happen in this COVID situation. You needed to have funding to enable schools to actually implement whatever rules have been put out. You needed to have parent buy-in so that students would actually show up and attend schools. And you needed to have schools, and when I say schools, I mean administrators, I mean teachers, and I mean other providers that are doing services to make our schools run. They all need to have buy-in so that they're going to implement all these things and make the system run. But the laws as they have existed since at least the summer have been in place to allow for school opening and in-person services to happen, particularly for students with most severe needs, right? And there just hasn't been results. Our schools aren't really opening on large scale, and we're not seeing the type of services getting to the students who need them. And there are a lot of different ways that different players have been trying to go about to resolve this problem. You have governments, state and federal, making efforts to try and provide that funding piece, right? So in December of 2020, Governor Newsom presents the Safe Schools for All plan, which is $6.6 billion that are supposed to go to California schools to enable them to open and start providing these services to our students who are most in need. And most recently, you have the Federal Recovery Act. Both the state and House plans include $130 billion that are supposed to go to the K through 12 schools to help these schools reopen. And there's even 20% of that 130 billion are supposed to be targeted to make up for lost learning opportunities. So we have those first two elements of infrastructure and funding to enable us to open schools, but we're having trouble closing those gaps and actually making it happen. And as you mentioned, there are a couple different reasons why that's happening. Obviously, back in January, like the pediatrician said, that was probably not the best time for most parents to send their students back into the classroom. So you didn't have that parent buy-in. But as numbers have gone down and gone back to matching where we were in the fall, you are seeing pressure and parents wanting more of those services to happen and to get more of that support. And the barrier we're seeing right now is we're not having as many schools taking advantage of the procedures that are already in place to start opening and providing services to the most at-risk students. What am I referring to, right? So we have in California SB 98, which the state legislature passed a law that is supposed to provide for in-person instruction to the maximum extent allowable under local health guidelines. And in LA County, that's 20-25%. And of course, you have to go through this waiver process. School districts have to be audited, as we heard about. But we're not seeing those processes get taken advantage of, and we're not seeing schools make use of the already in existence authorization to start opening and start serving these students. And I think we've all kind of observed that there's just practical barriers. How do we get our schools to actually do what they're allowed to do under the law? And that's a wall that hasn't totally been crossed yet. As you mentioned, our organization filed a writ to try and get an order to force the Los Angeles Unified School District to adhere with SB 98 and open for those highest risk 25% of students, like LA County Department of Health already allows for. And we also wanted the court to order school districts to implement IEPs and conduct assessments as they're required to do under state and federal law. But that writ was not granted, and so we didn't have that affirmative order from the Supreme Court saying, hey, you have to follow the law, even though we all know the law says what the law says. There have been other school districts, for example, there's Martinez v. Newsom, which was a class action that tried to attack the fact that these school closures aren't taking into account individual student needs. And so you're not seeing decisions about student remote programming happening on the type of data-informed, assessment-driven process that the laws intend them to be. And there's a lot of celebration because that case obtained a settlement agreement, but the settlement agreement essentially just ensured that the governor would say that SB 98 says what SB 98 says, and that there are no waivers under or of the IDEA in existence, which is kind of where we all are right now, right? We know that the law says these things have to be happening for our students, but we still practically are not seeing these things happen. So litigation is still ongoing. We see up in San Francisco, for example, kind of a shift starting to happen where local government bodies, in this case, the city of San Francisco, which has relationships with their Department of Health, are telling schools, you need to open. And when you have that kind of partnership and a city taking the steps as opposed to families or organizations, it'll be interesting to see if that results in a different outcome, because thus far schools have been very successfully able to say, we are, the federal law says what it says, the state law says what it says, but we are complying with our local our local Department of Health rules and guidelines. And we don't have to open. We can do this waiver process, but we don't have to. So when you have local cities like the case in San Francisco saying, but you should, that's going to probably take away from this argument that has thus far kind of provided cover to schools to not take advantage of those opening opportunities. So that case is set for hearing on March 22nd, and we'll have to see what happens in that case. Another thing that's going on in our special education student programs is anybody who's in the IEP or IDEA process knows kind of how the system works, right? You are initially found. To qualify, you have to receive an initial assessment, and that assessment looks at how a student functions, their disability profile, and what their needs are. And if they meet state and federal qualification guidelines, then a comprehensive program is developed with input from all sorts of different players, and they come up with a plan about what's going to happen for the next year. And over the course of the year, you're also doing ongoing assessment and ongoing data collection to make sure that this plan that was customized to this student based on their assessment is working. But with school closures, not only are students losing access to the instruction and the related services that they're supposed to get, but we've also seen school districts just refuse to conduct special education assessments, which really puts a kink in the entire system, right? Because that, for all students who are already in the door and have special education eligibility, we're talking 12.5% of all students across California. For those students, we've really put blinders on, and our educators don't have the data that they need in order to make any sort of informed plans about programming. And they also have no way to really track how far behind these students are falling when they're not having access to what we had already determined was appropriate. So that's a real problem for students who are eligible, but the lack of assessments that have been going on are also critically important, because there's a percentage of students above that 12.5% who we suspect have disabilities, and they just haven't been found yet. But if there is no assessment happening, there are all these students who should be getting into this system and having all of these civil rights protections applied to them, who just cannot, because the assessment process is essentially being used as a gate to keep them out. And thankfully, along the same time as our writ was going up, there was a state compliance complaint that was filed against the city of Sacramento Unified School District. And CDE investigated similar claims where that school district was not conducting assessments of a student, and that there was potentially a policy to just not conduct assessments during the time of COVID. And CDE agreed with the student and found, in fact, that there was a policy to not conduct assessments during COVID, and affirmatively said that's not allowed, that's in violation of the law. And so the Sacramento Unified School District has been ordered to make up all of the assessments that are that fell behind and were out of date now. And we've seen that kind of trickle out. So other school districts have at least started picking up on the assessment piece. Hopefully we can stop the bleed in terms of making our teams go without the data that Congress intended them to have. For example, LA Unified started conducting assessments 5 days ago, likely as a result of this decision, but we still have a long way to go in terms of ensuring that the procedural protections contemplated by state and federal law are actually implemented, and then just practically figuring out how we're going to close these gaps that are created for students with disabilities.
And when you talk about assessments, I'm sure that a lot of the assessments are, if they are being conducted, a lot of it is through done virtually. Should they be done in person?
So that is a very fact-specific question, and this was one of the arguments that we had from school districts throughout the 1920 school year and at the start of 2021. School districts said we can't possibly do an assessment remotely, so we're just not going to, and we'll get to it back when we reopen. And there are some types of assessments where it doesn't make sense to do a remote assessment, right? Some testing batteries are specifically designed to only be administered with this many feet between the student and the tester. But all of those guidelines are really tied to the standardization process that's happening by these test publishers. And it is the case that there are some testing batteries and assessments that can be done without any change in appropriateness or reliability through some sort of remote measure. So we got guidance, I believe it was September of 2020, where the United States Department of Education acknowledged that this testing situation was an issue, but specifically said you have to do the best you can, do remote where it's possible, do records review when you can, and if you have to supplement once we reopen, then you could do so. But you can't just wait and do nothing until schools reopen and you have in-person meetings.
Okay, let's talk about this virtual learning and some of the challenges that children with disabilities have been facing. Can you talk about those challenges?
So our experience has been that students with disabilities are experiencing the learning losses we see across schools, but to a higher degree. And in some cases, those losses are going to be more lasting, and they're going to be more marked. And it's difficult, right? Because like there's this ongoing message about how we're supposed to write off this year and give everybody a pass, and we'll deal with this when we get back. But for a lot of our students with disabilities, that's just not an option. And there are some students for whom this missed time is something that could potentially not be recoverable, right? And when I say that, I'm thinking about a couple different types of students. Just from a straight procedural standpoint, we have like older students who have reached the age-out age, turned 22 in the state of California during pandemic, and they have had their access to special education just cut off. And I don't see any way for those students who have aged out to get back and get help. I'm thinking about students who have disability profiles that have crystallization periods for skills, right? Who, if you don't focus on targeting language or socialization or behavior or other motor deficits before a certain developmental milestone, recouping those skills becomes much more difficult, if not impossible. And then there are our students who just have significant social emotional presentations for whom, like we heard before, the lack of access to school supports really can become a matter of life and death for those students because they're being pushed into unsafe situations. And those are all students for whom it's most important that we have this ongoing monitoring, assessment, and planning happening during remote learning and get them back as soon as possible, because those are not situations where we can pick up and keep going as though this were just a lost year.
I think that, you know, a lot of cases when people talk about children in general, they talk about how, oh, this is just temporary. You know, they're learning different skills while they're home. They're learning about family, or they're learning about, you know, using the technology. But I think it's very different when we talk about children with disabilities, because these kids need to have their therapies. And I think that people need to always be aware of that when we talk about these children.
Yes, I think that mindset also ignores the fact that there are certain school readiness skills that may be completely natural and come without much designated instruction to neurotypical students, but which take a significant amount of time for students with certain disability profiles. And there are some students where before they started going into school, there had to be transition plans and significant thought about how you're going to prepare the student to be able to sit in the classroom, receive instruction, process it, and keep it. And we're essentially restarting that process for a lot of students, and they're going to have planning and services to make them ready to be able to get back into that learning mindset. It also ignores the different experiences for parents, right? Like, I'm sure there are some parents who have loved learning how to become their children's teacher, but I think it's been a very stressful, difficult experience for a lot of us. And I think that experience is compounded as you add on kind of levels of different experience, right? Like if you have a family who has, by virtue of their background or financial status, difficulty accessing education, that's one layer of added difficulty and stress that's put on that family. And if you throw in disability profile, that can become exponentially more complicated. And I think also is detrimental to the relationship between parent and student, because the roles kind of get mixed, right? Like it's very difficult if you have a parent who's supposed to be supportive, helpful, guiding, advocating on behalf of the student, kind of the safe place for our kids to fall, having to be the person enforcing school expectations and really running the school day. Normally there's a division there, and blurring those lines, I think is going to have lasting impacts on our kids. And also we're going to have to look at how that parent-child relationship is affected, and possibly even look into addressing that situation with services, which are already allowed for under the law, right? Like parent training, parent support, parent counseling are all services authorized under state and federal law for kids with disabilities. And that's something that we should be looking into moving forward.
That's such a great point, because I was going to say that all of these kids were sent home, and to just to have these parents just all of a sudden become homeschooling teachers. And there are parents who love that kind of stuff, but there are also a lot of parents who are just not the homeschooling type. And on top of that, these parents don't have any training in special education. They're not trained to act like or do the things that a speech therapist or a physical therapist or an occupational therapist do. So I think that it has caused a lot of stress on the parents, and hopefully the schools will recognize that and even offer more support going forward.
I certainly hope so. I think that's something we're going to need to be keeping track of as schools start going back and we start reopening and getting back to the plans we had in effect before schools shut down. And now that assessments are coming back, like making sure that we get baselines and see exactly how much was lost between when shutdowns happened and when we go back, and being very emphatic as we advocate for what should be done now to move forward, right? It's been just kind of a general practice that educators are able to come in and speak understandably, but very authoritatively about what a student needs. And parents have often felt in the IEP process that because they're not a teacher, that their input is not given as much weight. But over the last year and however long it's going to take before we actually get back, parents have actually had to sit in that teacher role and have had to carry a lot of that burden. And I think it's going to be very important that they gain with that difficulty much more voice when we come back to the IEP table and start saying what our kids needs, because we have had a bigger role in actually implementing the program. So hopefully that follows through and could potentially be one benefit from this craziness.
Yes, and we'll of course talk more about IEP issues with David as well. But before that, Dr. Altmann, would you like to add anything about that, like as a medical professional, anything about the mental health impact on parents?
Yeah, I mean, I think mental health is, so important nowadays, and something that's, often overlooked. I mean, it's been so exhausting and hard on so many of these families. And, as I try to talk to parents in my practice about, it's like you have to take care of yourself, and focus on your own mental health to be able to take care of your kids. But as a parent, we know it's hard, right? I mean, I have 3 kids at home right now. And, and granted, they don't necessarily have special needs, although I do have one, with ADHD that's had some more challenges from learning on Zoom. But it's challenging for everybody. It really is, and I do think we need more resources available for these families, and especially as they transition back to school. I mean, as you mentioned, Alexis. I mean, it's nice that for some kids have learned new skills being home, right? My high schooler now can take care of my kindergartner on Zoom and make him meals and do his own schooling, right? But granted, not every child can do that. And so it's, I think it's going to be a challenge, when we do open up, and especially next school year, because we're essentially going to have to go back and relearn what these kids should have learned over the last year. And when it comes to the therapies, as Alexis mentioned, many might be even older, and we know that early intervention is so important. And so we're going to have to figure out how can we make up that lost time. And it's probably going to mean that they need additional therapies and additional services. And we're going to have to ramp all that up to catch up all of these kids that, are now behind.
Which is something, compensatory services is something that we'll also talk about with David as well. So David, so when the pandemic first hit, schools were completely shut down. I think it wasn't until a couple of months later that they actually started some type of virtual learning, including those for therapy services, which was really just a fraction of the amount of services and support that children were to receive according to their IEPs. Now, is any of this a violation of the law that children with disabilities were not offered all of the services listed on the IEPs during the pandemic?
Well, they had to be provided with a program that would allow them to make progress as anticipated in the IEP document. And so, if the districts were able to provide some subset of the services or modify them and provide them in a different way, and the student was still able to make progress, then, under the law, there's not necessarily a compensatory obligation. But that's really not at all what we've seen from many, many students. The programs, especially in the spring, a lot of the programs in the spring were so ad hoc and kind of given the, unexpected nature of the emergence of the pandemic and the shutdown and stuff. So I don't think there's many school personnel and teachers that were happy with how things went in the spring. But even even as kids have returned for this school year, when there was more time for preparation and when there does seem to be a fuller program in place for most kids, students with disabilities still are receiving services. Many students with disabilities are receiving services that are just a fraction of what's in their IEP. A lot of kids are not making anywhere near the progress that would have been expected based on where they were at the start of the pandemic. And the way in which services are being delivered is not necessarily effective for many, many students. So I think someone pointed out, there are students who are flourishing actually in some ways. They kind of like the extra time to process information. Some students with disabilities are really feel more secure, whether it's completely a good for them not to be put under the pressure of going through learning social dynamics and everything that's involved in school is another question, but some kids have been happy. But I think for many kids, it's been very difficult to access the materials and the services in the way that they've been presented. And unfortunately, the law that was put into place, which Alexis mentioned in the summer, which kind of put in place a statutory basis for this distance learning program, both for students with disabilities and students without. They, kind of gave a statutory basis about the obligations of schools to have distance learning plans in place. And within that law, there was also a requirement that students with IEPs have a specific plan added to their IEP for how their IEP was going to be implemented during distance learning. And that those plans have not been implemented, I think, as they were really intended. So obviously school districts kind of had a lot of latitude based on working with their local health agencies about how they wanted to implement their general education programs. And there wasn't a lot of, aside from kind of broad parent input at the district level or boards of education, there wasn't a lot of kind of fine-grained input about how districts were going to do that. They had discretion in terms of opening up their general education programs, how they were going to do that and to what extent. But for special education students, the IEP process is still, it's still completely intact. I think, as Alexis said, everyone knows what the law says, but there's a lot of, there's a lot of people just kind of ignoring it. And with respect to these distance learning plans and how they were going to be implementing IEPs and what had to be added to an IEP, I think that's something that also kind of was not really implemented as it should have been. So if part of every IEP that occurred, that was in place or that occurred during after the school shutdowns, if every one of those had to have a plan for how it was going to be implemented, that plan still had to be approved by the parent, just like an IEP had to be approved by the parent, and that didn't really happen. Most of the families that I've worked with were just kind of sent a plan that said, this is how we're going to do it, kind of in the same way that a district felt like the districts felt like they had full discretion about how they were going to implement distance learning for students without disabilities, and that wasn't consistent with the law. It really, to my mind, it completely bypassed the collaborative IEP process and completely bypassed parent input into how things were going to be implemented. And as you would imagine, what happened was that things were not done in a way that was individualized meaningfully for each student, right? So districts just as a whole said, well, here's how we're going to implement our IEP services. And we're modifying your IEP in this way. This is how we're going to do it. And obviously, once the individual children fall out of the decision making, then the whole IEP process kind of falls apart. And I think that's also tied in with not just the across the board. Here's how we're going to do speech therapy, or here's how we're going to do behavioral services. Which I think really left out large numbers of students by providing them with services that they just couldn't access at all. But also without any information about that was provided by the assessments, which are such a central part of the whole IEP process. The IEP teams were flying blind in any case. So they weren't even trying to individualize it in most cases, but even if they had wanted to, they didn't have the information. And Alexis referred to the CDE finding ordering Sacramento City School District to make up for its policy of not having conducted assessments. LAUSD had essentially the same policy. They would, people asking for new assessments and parents whose children were required updated assessments were simply told, we're gonna take a look at that when schools reopen, and we'll push it off till schools reopen. But for students entering the district, either as preschoolers or moving from other districts, that really provided them with no meaningful option.
And speaking about those IEPs, because IEPs are supposed to be about both parties agreeing on any type of change of services, but like you said, many of these parents weren't even given other choices besides virtual learning, and just a fraction of the services on their IEPs. And I think someone also mentioned that in the chat box as well, that the amount of services that they're receiving for classes, it's cut down. Even for therapies, a lot of kids have individual therapy and they have group therapy too, but it's, just maybe one of them is given to them, and it's all done virtually too. So it's very unfortunate that these children were not able to receive all the services that they were entitled to.
An example of service, I guess 2 examples of service provision that came up a lot over the course of the pandemic for me is, prior to the pandemic, LAUSD was utilizing distance speech services and distance-based speech therapy, online-based speech therapy, because there is a shortage of providers in California. And I watched at LAUSD, there was an extensive presentation that I was able to be a part of, where they said, okay, here's the considerations. We've done the research. It's been approved by the National Organizations of Speech Therapists for these groups of students. You can do certain things for these students, but of course we would never use it for this group of students with more significant support needs and more complex communication challenges. And it was completely clear from the same people who administer the LAUSD program to this day that there were large numbers of students for whom providing a service in that online for communication development was not appropriate at all. And yet, after the pandemic, just kind of everybody gets the same thing. And so it's really painful to talk to families and just to know that, look, even the day before the pandemic started, all the people who are now implementing this program were fully aware and believed that it would never be appropriate for a student with more significant support needs or more complex communication challenges. And so that's just one example. Another example that a lot of people have run into is students with significant behavioral learning needs. So students who have significant behavioral support during the school day in school, either a one-to-one aid or a shared aid. Behavioral learning is a huge part of many students' program, which is kind of the core of helping them to do all kinds of things, socialize better, stay engaged in their work, learn the skills about being around others with and without disabilities in a way that's not going to be off-putting, that's going to allow them to have more friends and everything. So many students have been receiving services through a kind of online, they'll be online and they'll have, an aide on an iPad trying to prompt them, or they'll have an aide who's part of a class but never speaks. They're present because that's in the IEP, but they never speak. It's just incredibly, I think it's been incredibly difficult for those students to have any kind of meaningful behavioral learning during the pandemic. And again, the blanket policies of not allowing any agency providers to go into people's homes, even if they're willing to, just the blanket policies, which I guess some districts felt were necessary for consistency or to reduce their legal liability, have just been devastating to families, because a lot of providers were willing to work individually with students who required that, and were actively prohibited. Districts said, we won't pay. We won't pay for you to finish the independent assessment, which we've already agreed to fund. You cannot do anything in person, or we won't pay for any in-person services because we don't want a contract to have anyone in people's homes during this time. And for a certain subset of students with more significant support needs, that's just been devastating.
And I do want to talk further with you, David, but I know that Dr. Altmann does have another event to attend at 12 o'clock.
Sorry. I'm so sorry, but I think you guys will continue this discussion, and hopefully help those that are listening and give them some solutions that can help their students and their families. If you have any other questions, please feel free to reach out. And I'm so sorry I have to cut out early now, but stay safe.
That's fine. Yeah, thank you so much, Dr. Altmann. And if there are any questions directed towards you, I'll make sure to do some follow-up work, and I'll be in touch with you. Thank you so much. Okay, thank you. Okay, so David, going back to these aid issues, I did want to mention that because there are a lot of children who have on their IEPs these one-on-one aid supports, which I think that they just weren't provided with that help. And as we talk about the parents again, these parents were the ones who had to become their aides too. So that definitely wasn't easy for a lot of the parents out there.
Yeah, I mean, behavioral learning is so central to the educational program, the entire educational program of many students with more significant support needs. And without a highly qualified behavioral support person helping them engage all their, participate in all their therapies, engage in classwork, remain on task, everything kind of falls apart, and there's been huge regression. And I've heard so many different variations on how districts have tried to implement those services, and many of them were just baffling. I know that some people have, there are many aides that sit in on classroom calls where the teacher's providing education to a general education classroom, and they're on the same call, so they can't really speak to prompt their student, even if they see the student not paying attention, or if the student turns off their camera and walks away. They just don't know. And districts are some districts, they have just a policy, that's how we're going to do it, or we're going to have the person on a separate call and they'll be watching and they'll prompt. And again, one size fits all really leaves the people who have more significant needs for support in a horrible position.
So what can parents do going forward? I mean, at this point, now that many schools are offering, maybe some type of in-person services, or some schools are actually, considering opening up. At this point, can parents immediately request these in-person services, even if it's not offered in the beginning, as listed on their IEPs, as well as compensatory services for all of those missed hours of class or therapy during the pandemic?
Well, I mean, it seems like there's a range of how districts are opening up, and there are several districts in the South Bay. Obviously, there's Orange County, which I've had clients attending school all year. Every time I talk to them, I'm just kind of stunned to hear about their school day. Then there's districts in the South Bay and some other districts in LA County that have opened learning, for small learning pods, hybrid models for different groups of students. And so I think if you're on campus and in person, then you should be able to access services in person. Obviously, assessments are now, I think even in places that try to continue assessments, they're just so far behind that's going to be just logistically, I think, a very complicated issue. I think they can do assessments in person at many districts, but I think logistically it's going to be very, very difficult. In terms of compensatory services, there's going to be a huge need for compensatory services, and I think that one tactic that a lot of districts are going to take is they're going to say, well, everyone has lost educational opportunity, and we're going to intensify our programs. We're going to provide all kinds of services to everybody, and that will make up for a lot of what the students who have IEPs have missed. But I think, again, if you think of students with more complex learning profiles, the law provides them with summer school programs to avoid the learning loss that's kind of inevitable. All students lose some learning over breaks, but it's because it's the reason that the IDEA provides for extended school year services is precisely because it's so much harder for students with disability, for some students with disabilities, to recoup what they've lost. And so, and that's talking about, the minimum state requirement is a 20-day program. So most districts have defaulted to that, but there are many students with extended school years. So they have no break longer than a week or two, because that's the level of consistency they need in order to maintain any gains that they've had. So the idea that without really meaty and substantial programs of compensatory education, the majority of kids who have significant learning challenges are going to be able to make up any of this is just not realistic. Districts, in addition to saying, well, we're providing intensification of services for every student because every student's lost opportunity. Some districts, especially LAUSD, appears to be taking the position that it's improper to call them compensatory services, because that indicates somehow that they're at fault for not having provided them. And so they're terming them recoupment services, and trying to kind of make some kind of distinction about how that would, how those are decided on and apportioned. I don't think that it's correct that the term compensatory services or asking for compensatory services in any way implies that the district was at fault. Really, the concept is basically, if we made a plan for, for this student, we're going to, these are their present levels of performance. These are the goals that we think would be meaningful for them, show meaningful progress in the course of a year. And so we're going to put services in place. If because of the pandemic, they didn't get anywhere near making a year's progress in a year for them, which can mean a wide array of things depending on the student, and to the contrary, ended up regressing significantly, then what they should be provided is services sufficient to kind of put them back in the place they would have been otherwise. And you can imagine for students who have a hard time gaining basic skills and have really put in huge amounts of work just to get kind of some baseline pre-academic skills, and also baseline appropriate behavioral skills and social skills to be within a classroom. It's going to require really, really huge amounts of interventions and really specialized, individualized, intensive interventions to get them back where they need to be, or where they would have been but for this loss. I don't think that implies that the districts did anything necessarily wrong. I'm sure obviously there's a range of how well districts were able to manage this and how well they were able to provide programs for their students with disabilities. I think all district personnel would probably agree that some of the outcomes and some of the programs were not particularly strong. And so there's going to be a lot of students who have a lot of catching up to do.
Right, and especially with the therapy services, I mean, when you think about that, like I mentioned, a lot of children received only a fraction of the amount of therapy that they were supposed to get according to their IEPs. Is it possible at all to get more hours and makeup hours for those individual therapy services as well?
Yeah, it's possible, and I think some districts are going to be really proactive and reach out to parents and say, here's where we think your child is functioning right now. We believe that they need some compensatory services in speech or occupational therapy to kind of get them where they would have been otherwise. I think a lot of districts are just kind of keep their head down and hope that they don't have to provide these huge amounts of compensatory services. And so then, bringing in advocates or attorneys to negotiate with school districts about putting substantial blocks of compensatory services in place is probably going to be necessary for a lot of people in a lot of different districts. I assume it will work out fairly smoothly, but I think that especially in the larger districts, I think that many of them will probably plan to, provide either a minimum amount of compensatory services or just kind of provide the same thing that they're doing for everybody else and hope that most people don't come and ask for large amounts of compensatory services. So.
It's unfortunate that a lot of parents, when they walk into IEP meetings to discuss, issues like this, they always feel like they have to go and fight for the services that their children need to get. So hopefully, I think in this case, it may be, in a way, it may be better to, especially if your school is not offering that upfront, then maybe try to get an advocate or possibly an attorney involved in those discussions. And I wanted to also talk about the mask issue. I know that we briefly talked about this with Dr. Altmann, and I know that there were some questions about that too. Can you talk about those CDC and CDE guidelines about children with disabilities and those mask requirements?
Well, it's similar to what Dr. Altmann said of, kind of gradually introducing things. I think that, the idea is that for a large number of students who have difficulty either wearing a mask or keeping a mask on throughout the day, that's a learning opportunity. So I think some districts, some letters that I've seen from districts say, if your child can't wear a mask, they can't come to this hybrid program, or they can't be back on campus. I think that's not the right way to go. And I think a lot of districts have recognized that it's a learning opportunity. So both in terms of kind of sensory stuff and behavioral stuff, that you have to kind of gradually help the students obtain those skills. And most students will probably be able to do it. You know, a lot of kids who resisted a lot at the beginning of the pandemic are able now to go out and be in public quite comfortably in masks. But the one thing that really seems not appropriate, that should never happen, is that students shouldn't be barred from access to programs because they have, you know, sensory issues or disability related challenges that just don't let them or make it impossible for them to wear a mask consistently. I don't think that that failing to provide additional accommodations and support that student in the classroom is an appropriate response.
Great. And also, I do want to talk about inclusion issues, but before that, you know, we have a couple of specific questions that I think that we could try to go and address first. I think that our panelists have been great with answering questions as they come through. So I think there were a specific question by one of the attendees. Alexis or David, maybe you can try to answer this. She has a dyslexic second grader who's been in high needs cohort 6 weeks for only 2 hours and 4 days a week. They only do 1 or 2 math or English worksheets a day, and her son is now 2 years behind. The achievement gap is so wide, he can't be in general education class without being lost. Reading services are on Zoom, are abbreviated and rushed. What do we do with our child in crisis and failing so far behind?
I think moving forward, we talked about how perhaps COVID could be an opportunity for us to revisit how we treat parents as part of the IEP planning process. And I think in addressing issues such as this this participants is perhaps another opportunity to start kind of revisiting that, because what we see happening a lot in standard special ed programming for kids who have this sort of learning gap is the idea of like pull-out services or something else that's going to happen during the school day and perhaps take away from recess, or like science or some sort of trade-off. But because COVID has forced these gaps to be so widespread and so significant, prior resistances to having outside of typical school hours services is probably just a concept of service that school districts should think about revisiting, right? Like it used to be a very big challenge if you were pushing for a school district to give you like winter break reading camp or over the summer intensive math remediation. That was a big fight. And the theory was, well, we can do pull out and give him so many minutes a week and that will start closing the gap. And then it, parents were not wrong in pointing that included a trade-off, but situations like this are probably going to force us to have to rethink this. The good news for a second grader is being 2 years behind, you're still in that window where you can close those gaps, and we have to be very aggressive and confident in our advocacy to make sure that this particular family and families like them are confidently able to go in and say, by X date, I want us to be back to grade level because my students' disability and cognitive profile mean there's no reason that we shouldn't be at grade level. And we just have to start forcing the IEP team, which is supposed to be completely individualized. Anything the kid needs is supposed to be on the table. We have to really make sure that all of those approaches are back on the table.
And do you want to add anything on that, David?
Yeah, just one thing. I mean, I think what Alexis said is really great. A lot of, my understanding of the reading research for students with learning disabilities is that what's happened in the past of pulling kids out of their classrooms during reading to do specialized reading is exactly the wrong thing. You want both and, right? So you want them to be participating in the full reading curriculum, even if they're behind, even if they're studying, like struggling, all the English language arts that they can get among their typically developing peers is essential. And they need individualized direct instruction, the kind of systematic direct instruction to build their core skills in reading. And I think districts have been incredibly resistant to that research finding, because they think, I've been in meetings where they're like, well, why do you think we owe you extra? You have to, you want it outside of school. And they act so, not everybody, but it really is a concept that hadn't been fully embraced. And I think that, just like Alexis pointed out, this could be an opportunity for people to kind of be more flexible and realize that the kind of both and reading instruction that research shows is effective for students with learning disabilities could be put in place now, especially using some of the compensatory services that they might be open to providing.
And we also had a question related to compensatory services. I know we briefly talked about this, but what about the kids who are supposed to be getting 500 minutes a week of SAI, but who sees the teacher 20 minutes per day, often in groups? Some of the time she's with a paraeducator. So if she's not getting her minutes, would that be a cause for the parent to ask for compensatory services? That was the question.
In theory, absolutely. How that complaint would proceed through whichever channel that family wanted to go through is going to be a little fact specific. And there is this reality in IDEA compensatory education law that we have to confront, which is that a failure to provide services, even if you can prove that there was that failure, doesn't necessarily entitle a family or entitle that family to remedy, right? In figuring out what compensatory services are owed, CDE or administrative law judges are doing a fact-based inquiry about what the evidence shows the failure to provide services caused in terms of harm, and what the evidence shows is called for in terms of closing those gaps. Again, there is that random student for whom 20 minutes of introduction is fine, and they're set up to do independent work, and not providing those minutes is going to be you might not be able to show that that caused any sort of lack in terms of ed progress or opportunities to learn. But for most students, getting 20 minutes when you're supposed to be getting 500 is obviously a very significant material breach, and you are going to have losses in learning and progress that any number of experts could come in and say, this is the appropriate way to close those gaps that are clearly seen because they didn't get what they were supposed to be getting.
And also there's a question just about how hard they can push to get in-person services and what their rights are. One of our attendees said that, asked if, what are the options when we're told based on current health guidelines that there isn't availability for our child to get services in person. Our school is opening for hybrid and only providing limited services to certain kids. My son received his IEP in the pandemic and has yet to receive any services in person. So he wants to know how hard he can push for in-person services.
So I think this question touches back on this kind of cart before the horse problem that we see happening in special education generally, but particularly during the pandemic. The way the special education planning system is supposed to work is you're supposed to look at a student's particular needs, the assessment data, and then all determine how we're going to give this particular student the type of programming that he or she needs. And what we instead see is quotas or limitations, or this is what we're doing, and we're trying to fit this student into what's already in place. And that doesn't sound as though it has any of the individual planning elements that should be contemplated as part of that exclusion, right? It's not a situation of your IEP needs being that you can get it remotely. It's just we don't have any more space. For situations like that, where you have some students coming back onto campus and some students not yet greenlit to get back onto campus, I have additional questions, because there are additional non-special education but disability related things that could be at play, right? For example, are the students who are being deprived access back onto campus students who have more significant behavioral issues? Is it some sort of discrimination situation going on? Like, why is it that the cutoff was here? So that's just one question that comes up from that particular scenario. But beyond that, just because the campus doesn't have any space for in-person learning doesn't mean that the student is not entitled to in-person instruction. So if you don't have a classroom that has space, but this student needs in-person instruction to benefit, then that IEP team should be revisiting and saying, well, maybe we need to spend or to send a tutor into the home to provide that type of face-to-face instruction or those related services in an in-person model. But it's not acceptable in my interpretation of the law to just say, sorry, no space, we'll get to you later.
No, I mean, I think that that really covered it. I think, unfortunately, a lot of students who required either in-person behavioral support or in-person services in order to access their program, whether or not they were able to get that depended on two completely, contingent facts. Whether the family had the resources to go out and pay for it. Because it hasn't, in my experience, it has not been particularly difficult to get reimbursement when families have had the means to obtain individual services, which, as an equity issue is really troubling, because it's almost impossible to get a district to agree to fund them prospectively. Where I think, yeah, I mean, there's been some exceptions, but they're really rigid about that. But if a family can obtain them services, then it's been, I think most special education attorneys are able to get reimbursement for those services pretty consistently. But the other thing is, even if you do have the means to pay for the services in advance and seek reimbursement, there's just not very many people available. It's been really, really hard for lots of parents to find qualified people to come to their homes and work with their children. So, but as a general matter, the average parent who can't spend tens of thousands of dollars to have people coming into their home privately or who wasn't able to find them, although they have a right, if that's what their child needs and it's possible to do it safely, it's been very, very few and far between the number of people who've been able to get that to happen so far.
And I think that it's good to also talk about these free or low cost legal services that people can get, because I think a lot of people may need assistance and help, but they don't even think about reaching out to advocates or attorneys because they're thinking about the cost. Can you guys just briefly talk about the types of services that are available? We also have one of the handouts that we're going to be sending out is an entire list of free or low cost advocates and special education attorneys. So if you guys want to both talk briefly about that.
At the Learning Rights Law Center, we have a number of different opportunities, and we try and provide support to lower income families who wouldn't otherwise be able to afford a private attorney necessarily. We have separate cases that we take in our litigation department. We also have the Education Rights Clinic, where we have attorneys, advocates, and volunteers who have gone through extensive training, who are able to go through a family's situation and identify potential issues and help kind of set the family on the path towards preserving their claims and hopefully addressing their situation through informal procedures. But if they're not able to do so, we can transition them over quickly to getting assigned an attorney and bringing whatever sort of claim they need. But I also think what is really unique and important about the Individuals with Disabilities Education Act and Section 504, kind of the two main statutes that you see providing civil rights protections to students with disabilities, is that Congress knew that families were likely going to need help in order to be able to enforce this really ambitious civil rights law. So they built into both statute fee shifting provisions that allow families to engage the help of an attorney in the hopes that they'll be able to recover fees from the school district if in fact they're able to demonstrate that the district has committed violations or failed the student in some way. And that enables a lot of firms, including Vanaman German, to be able to take cases, and he can describe kind of the arrangements and how families can find their way to private firms.
Yeah, I mean, Alexis's learning rights and Alexis's whole team, I mean, they touch a lot of families in Southern California through their education outreach and through their individual representation and their clinics. But they do have, you know, as a legal services organization, there is an income restriction on who they can work with. Fortunately, as Alexis described, you know, this is a civil rights law, and Congress was aware that just like in a race or gender or age discrimination case, in order for people to be able to access the rights that they have under the law, they had to be able to get attorneys, and it was going to be really hard if they had to pay up front for all of it. And so many attorneys, I think we're going to distribute a list of, you know, kind of statewide list of lots of attorneys who are willing to work either at reduced fees or no fee to support families throughout the state. My firm does do probably more than half of our cases for families who couldn't otherwise pay, and you know, we're happy to seek our fees from the school district, and if we don't get them, then we don't necessarily charge the family. I mean, some people, you know, depending on the case, depending on the facts, different attorneys charge, you know, a sliding scale fee, and sometimes, you know, it's a few $1,000s to kind of supplement what's likely to not be a full recovery of attorney's fees. But the opportunities are out there, and there's many attorneys who are willing to work with families, and especially on meritorious cases. I think that it's always worth trying to consult with a couple people, because you know, if what's happened to your child is really clearly actionable, I think you're going to be able to find some help somewhere from a qualified attorney who will either be able to work pro bono or will work with you on a sliding scale. I think there are a lot of people willing to do that.
And also it kind of relieves some of the stress that parents may feel as they try to navigate the system and just deal with the school districts too. And one of the issues that people may need to seek some legal help is this inclusion issue. And I know that we're almost out of time, but if you guys can just briefly talk about, you know, inclusion issues and you know, here locally, although many schools have some sort of inclusion or mainstreaming program in place, there are also many who have programs, but their school may just not be equipped yet with the appropriate education and training regarding inclusion, so that children with special needs actually feel included. And I'm sure you guys have handled numerous cases throughout your careers as special education attorneys and advocates. And so can you just briefly talk about what are some of the challenges that parents and children with disabilities still face as they try to navigate the special education system?
So regarding inclusion, I'm just going to jump in again with another, let's try and make COVID turn into an opportunity to improve. And I think COVID has really opened the eyes to a lot of our neurotypical students who might otherwise not have really identified the isolation or the exclusion that a lot of our students with disabilities experience quite regularly. So with that in mind, I remain hopeful that as our students go back, those typically developing and those with disabilities, this shared experience can kind of start opening eyes and start seeing two populations on our campuses that didn't otherwise get to interact because of either systemic barriers or just a lack of awareness. Maybe they'll start seeing each other and start having more of a vested interest in making sure that all students don't experience kind of the difficulties that COVID or kind of any learning difficulties can pose for students. In dreams of other careers, always thought about how could we develop a system where all of our students had a vested interest in making sure that everybody else was able to cross the finish line and having some sort of buy-in in a shared success. And maybe COVID will give us the opportunity to kind of start working towards that as kind of a more social agenda. But beyond that, David has extensive experience in kind of inclusion cases on a school district, even school by school basis. And unfortunately, I think those continue to go on.
Yeah, I think one of the most important parts of the law are the provisions which support all students being educated together. The default is that all the kids in the community go to the school down the street and they're educated in a general education classroom among their peers and their neighbors and their siblings. That's the default. And the presumption is strong that every student should be provided with the supports they need to be successful within that environment. And I think that that presumption gets lost a lot of times. And we have this whole system of segregated special education classrooms, and because they exist, people think they need to be full. And the research doesn't support that those classrooms help kids learn more or gain more skills. In fact, quite the contrary. All the research that's built up over the last 40 years supports the idea that for any student, if they're provided appropriate supports, they're going to make more progress in direct correlation to the amount of time they spend in a regular general education classroom. There's all kinds of reasons for that, and why that finding is consistent. There are many factors, and we take a long time to go through them. And there's also many factors about why the assumptions about segregated classrooms being somehow superior for certain groups of students. There's a lot of research about why those assumptions actually aren't borne out. There's not more direct instruction. There's not, many of the assumptions that people make about what would go on in a smaller, more specialized classroom are just incorrect. Students really do benefit from being in inclusive settings with appropriate supports. And so that's the biggest piece, which I think Cindy was kind of alluding to, is, getting in the room is not enough, right? You don't have to be, at grade level or performing near your peers academically. You don't have to earn your way into the room. Everybody should be in general education, because a special education student, especially one who has more significant learning challenges and more significant disability-related deficits, they're trying to make progress on their goals that the IEP team has determined, would show meaningful growth for them. So even if you're in a 4th grade classroom or a 5th grade classroom and you're working on kind of, one-to-one correspondence to learn the basics of counting and addition, you still have the right to be in there if you can make progress on your goals. The student can make progress on his or her goals within that setting. And that idea just gets, I don't know if it was ever really established, but it gets overlooked. That grade level is not what we're talking about. Everybody has the right to be there if they can make progress on their program, from where they are, make meaningful progress from where they started until the next year. And so, but it's hard, and districts, a lot of districts have gotten, California is very, very far behind in terms of the number of students that are included within general education settings for 80% or more of the day, even 40% each of the cutoffs. California still, which is, I think, surprising to a lot of people, relies much more heavily on segregated special education classrooms than most of the states in the nation. And we're behind in terms of implementing the research findings that have supported general education classrooms. And so it's important that people push for those classrooms, and it's more important that that the supports and the knowledge is built in and provided to the school personnel so that they can do it well, and so that the kid really can grow and succeed and be part of that environment. Because just being in the room, if you're not really supported and the adults around you aren't thinking, how do we make this work for this child, is not going to be enough.
This phenomenon that happens, and you see it where, like, at the point you have a student who is removed from the general education setting, expectations for what that student's potential are really start falling off. And you saw this even back when the United States Supreme Court took the last special education case that they took, which was 4 years ago with the Andrew F. decision. And that case came about because the idea was, if the student's not in the general education setting, which by virtue of being in the general education setting, you have all of these built-in just legislated baselines, right? You have grade level content, you have grade level curriculum, and you at least know kind of where a student stands with respect to that. But if you put a student in a segregated setting, there are no rules and there are no expectations, and everything is automatically supposed to be individually driven, which is good. But we haven't figured out a way to kind of address all of the ableism and the implicit biases that start reducing expectations for students. It's really easy when you have them separate and you're not seeing them next to what a non-disabled neurotypical peer is expected to learn, to just start feeding into kind of these worse hidden biases that exist and not expecting as much. So that kind of goes along with the inclusion. Like, it is absolutely true that students who aren't at grade level deserve to be in the classroom. It's a task, you have to figure out how to do it right, but they absolutely deserve that. But just because a student can't be in there doesn't mean that it's okay that this fall off on expectation automatically follows.
And what's sad is that also a lot of the schools don't even offer the option of inclusion, even if they're able to do so. And I can, make my own example of my children. My children are part of a school that has both gen ed and special ed on the same campus, and yet they're completely segregated. And of course, since we knew, about inclusion and mainstreaming issues, we had requested that. And so we were able to get, some hours in the gen ed classroom. But what's very unfortunate is this is why I talk about how some schools have this inclusion program, but they're not really equipped with the right amount of education, is because I've actually had the supervisor of a school tell me and other parents of children with IEPs that our children would not have been accepted into their gen ed classes unless they had one-on-one aides, as they would have been too difficult for their teachers to handle. And now this was even before these children set foot in these classrooms, before they even saw any type of interaction with the teacher. So it was a very condescending tone, and it really left parents feeling like she was basically trying to put everyone in their place and letting them know that your children are difficult, but we're making an exception here. And the fact that these people just wanted to just went ahead and judged and made that assumption that because of our children were, coming from special education classrooms, that they would be difficult. I mean, this left parents feeling very discriminated and unwelcomed. And the problem is that when you have people from up top and that kind of attitude, it trickles down to all the staff, which of course, to no surprise, led to a series of events that had occurred after that, which I won't get into. But the biggest problem is that when these concerns are brought up, especially when it's from not just one person, but a multiple number of parents, instead of really looking into the matter and closely, or reaching out to all of those parents to investigate and really evaluate the situation, in many cases, these schools just end up justifying their actions or coming up with their own conclusion that their actions were not discriminatory. And how is this encouraging parents to speak up for their children? And how do parents try to speak up and fight every single incident like this when these schools don't take matters seriously and dismiss their claims? So I think that changes need to be coming from up top, and there needs to be more awareness or education done in schools like this, because in some cases, it's not just because they have malicious intentions. It could be just because they're not aware of what inclusion really means, or how they should be treating these children and families, or maybe it's even a culture issue, depending on where you live. So, but that's not an excuse. So I think that more awareness and education is definitely needed. Hopefully, we can get these schools just to do more education and have more conversations between the gen ed and the special education as well. And there was one question directed to David, and we'll make this the last question because we're over time now. Do districts have to pay attorney fees?
Well, it depends. The law says that if the case is meritorious, then I think Alexis might be able to correct me what the exact words are, but if you bring a meritorious case, the district is obligated, or the local educational agency is responsible, is obligated to reimburse the parents reasonable attorney's fees. In practice, in at least Southern California, most cases settle, and there's a negotiation about about attorney's fees subsequent to the case between the district and the client settling. Most attorneys wait until after to have any discussion about getting paid themselves. It's all about the reaching an agreement on the substantive terms. But it doesn't have to necessarily be the case that the districts pay. And if a case doesn't pan out and there's not a good result, then districts aren't obligated to. The threat and the reason why districts generally have a practice of trying to negotiate a reasonable attorney's fees as part of a settlement agreement is if attorneys are routinely forced to go to hearing in order to have the ability to represent their clients. So you have to go all the way through a hearing in order to win, and then you get the right to go to court and ask for a fee award. The difference between the size of the attorney's fees agreed to in a negotiated settlement agreement and the types of awards that people seek after a hearing, after applying to a federal court for a fee award, are vastly different, right? So it just makes a lot more sense for districts to be open to that, but it's not absolutely necessary. I don't know, Alexis probably has thoughts too.
I think that was what the law says, so.
Okay, thank you so much. So that was our last question. We've already gone over a lot of time because we wanted to, of course, try to address all of your comments and your questions. So that concludes our webinar. And before I close, I just want to give special thanks to those organizations who helped us get the word out about today's webinar. We have KACIE, IPIDC, Club 21, Special Olympics of Southern California, and of course, the American Academy of Pediatrics, Learning Rights Law Center, and Vanaman German. Thank you all so much for your participation and for your support. And thank you to all of you who have joined us on this call today. There will be a short survey that will either pop up on your screen afterwards or sent to you in a follow-up email about today's event. So I'd love to get your feedback and let me know if you'd like to be notified about future events hosted by KACIE Strategies. Thank you so much to everyone. Have a great day. I hope to see you at the next webinar. Thank you.
Thank you.
Thanks for having us.
Thank
Thanks.
you.